Hi, Jen. We get the lab work back on Mr.
Yeah,
Smith.
we did. I was
great.
actually just going to come find you. So his white blood cell count is elevated in his PMNs and his bands. We have a left shift, and in the UA we have some proteinuria and hematuria.
Okay.
And even his chest X-ray results with some nodules, with some cavitation. So there's something going on.
Yeah, it looks that way.
Yeah.
Well, I mean, we definitely need to be concerned about his kidney function.
Mm.
Looks like his ESR is a little raised too. So, I don't know, with the Janley lesions, the Osler nodes, the valvular regurgitation, he's meeting all the diagnostic criteria for Duke's criteria,
Yeah.
which is infective endocarditis.
Mhm. I was
That's
thinking
what
the
I'm
same thing.
thinking.
Yeah.
So I think we're going to have to figure out how to treat him. We'll probably run with an antibiotic. I'm inclined to send him to the IV clinic just to get on top of this. I mean, I'm fairly confident looking at the labs and the results of the chest x-ray and the physical exam that that's what it is. I'll explain it all to him, but if you can set up the appointment for the IV clinic as soon as he leaves here.
I'll get right on that.
And then I'll probably also send him a script for some, I don't want to go too heavy on the painkillers because he does have this narcotic background. So maybe just some Tylenol with codeine, and we'll see how he does from there.
Okay.
So we'll work on getting that script together. But send him in.
Yeah, he's in the waiting room. I'll go get him.
Great.
Mr. Smith, Lisa's ready for you.
Okay.
Mr. Smith, hi. Nice to see you again.
Nice to see you
Come on in.
too.
Come on in.
Yeah.
How was last night?
Oh, the coffin kept me awake, you know, but it's alright.
And how are those painful nodules?
There's like, they're here, they're still here, there are like more of them.
Okay.
Yeah.
So we got some of your lab results back, and we
Yeah.
had your chest X-ray results back. And my feeling, Mr. Smith, is that you have an infection called infective endocarditis.
Yeah.
Have you had it before? Does it ring any bells?
No.
Okay.
Sounds bad.
Well, it can be. So it's an inflammation of the inner tissue in your heart, and it's usually as a result of a bacterial infection. Staphylococcus aureus or streptococci are usually the two culprits that will give you that infection. So we need to treat your infection.
Oh,
most
yeah.
definitely. It's not the flu.
Oh.
Okay. We ruled out a lot of things, but I know you want it to just be the flu, but I know it's not.
Maybe more weed.
No. The symptoms of infective endocarditis, you've got the painful red lesions and nodules on your fingers and toes. Those are the Osler nodes, and they're very common in this diagnosis. Those splinter hemorrhages in your fingers we talked about yesterday, they're also an indication of infective endocarditis. So that's another way we know about it with the red palms. You also have a very fast heart rate, and that's very indicative. You have this murmur, and what's happening there is that your valves are struggling. Your heart rate's going very fast, your valves are infected, and your heart's not doing the work of beating the blood around the body. So your lab work is here. You have an elevated white blood count, which means that your body is fighting an infection. And also, you have elevated bands, and you also have blood and protein in your urine. And that's a good indicator of this infection too. So with your chest x-ray here, sometimes with the marijuana usage, we can see this. So this could be from the marijuana usage, but I feel that it's probably more from this infection at this time. So one of the diagnostic criteria we use to rule in infective endocarditis is the Duke and von Rein, and it says yes.
Oh.
So,
Man.
yes. You are going to get well, but it is going to take some time, and it does mean that you're going to have to visit our IV outpatient clinic to get some antibiotics by IV.
Oh.
And the reason we need to do this is I need to give you an antibiotic called vancomycin. It's been proving to be very efficacious in treating this disease. It treats it very quickly, and but it has to be IV for the first few days. So I'm going to set you up with an appointment for the clinic to get you started on that. I know your fingers and toes are sore, and I'm hopefully going to send you back with some pain medication so that you don't have to rely on the weed. That would be good. We need to talk a little bit about some of the services that we can provide. I need to make you aware of the risks going forward. You will get well from this infection, but you should know that you have an increased risk now for cardiac valve damage. You could have a stroke, and you're also at risk for kidney impairment.
Ooh. That's not good.
Risk-taking behaviors, I know that you said you didn't do IV drug use, but I do want you to know that if you did use IV drugs, it would increase your possibility for getting this infection again 20-fold. So you're still a young man, Mr. Smith. That heart has to take you a long way, and the risk of reinfection is very high. So if you would like to have some support services in place to help you with the tobacco cessation, the alcohol cessation, the marijuana cessation, and anything else, we can help you with that. Is that something that you would like to consider?
I'll check into it.
Okay.
Yeah, sure.
Okay. Maybe we can set you up an appointment before you leave, along with your IV clinic appointment.
Okay.
That sounds like a good plan.
Sounds like a plan, man.
Okay. I'm
Thanks.
glad. Yep,
Thanks.
you're well welcome. So off to the IV clinic tomorrow, and I'll send you home with some pain meds.
All right.
Try not to smoke the weed.
Oh,
Or smoke at all.
I'll try. I'll
Okay,
try.
Mrs.
Yes. Okay.
Hey.
All right.
Good. You're welcome. Jen, could you set up our friend there with an appointment for a social services consult too?
Of course.
Thank you.